One of the coolest things I've found being in this new space is I remember standing in the cardboard version of it. We as a team got to sit down and look at what from the provider perspective do we want out of our room and really figure out making the space the best for the providers and for the families. We really worked with families to figure out what do you need in the room. Having a TV with options to play video games or watch the TV. The walls have beautiful art on them and a lot of the rooms have windows looking out to the beautiful Pacific Northwest views that you naturally get from where we are.
The patient is put into what we call a universal room, and all the care is delivered to the patient. So they come to this room, they get all their vitals, all their laboratories, their patient visits, not only from their doctor, but from the wraparound care that we provide for the patient. And they also don't have to move to receive their chemotherapy and other essential services.
What's amazing about this team is truly the collaborative approach. When families get to us, I think we're often able to provide all those different pieces they need to not just treat the tumor, but to take care of their child, to support their development. One of the things that I've personally worked on in my own research throughout the years is bringing new medications in to kids with brain tumors. So there are some tumors now that used to be universally fatal that we can treat with a pill. We have clinical trials, we have treatment expertise, and we get them through it.
We provide comprehensive cancer care, and what that means is really all of the services that are necessary to care for a patient and their family going through a cancer journey. What you want is experts in all of these different areas, whether it's the oncologist, nursing, surgery, radiation oncology, radiologists, interventional radiologists. We all work together as a team, and every member of that team is crucial to help achieve the best outcomes. We also have unique psychosocial services to deal with the mental and physical impact of going through cancer therapy. We have unique physical therapists and occupational therapists who can work with adolescents and young adults going through cancer therapy. And then we also have oncologists and nurses who really specialize in providing care to adolescents and young adults. In addition to this, we have a comprehensive fertility preservation team who really thinks from that beginning of the diagnosis of how do we take care of one of the most important aspects of someone's health, which is their fertility, and think about that early on so we don't miss a tight window to preserve someone's fertility.
We also really incorporate a multidisciplinary approach to care. Physicians and researchers and caregivers here are on the cutting edge care. We have a team of some of the highest and most well-respected physicians, not only in the Pacific Northwest, but really in the entire country. Many of our doctors sit on committees and actually lead committees in clinical trials for acute leukemias, both in the United States and internationally. The high-risk leukemia team in particular makes sure that this patient and their family are getting a multidisciplinary evaluation of the patient, where that patient is going to be speaking to their oncologist, their bone marrow transplant doctor, their subspecialists, and all their caregivers at once and in one place.
We have disease-based teams, and each team has expert nurses, practitioners, physicians, social workers, dietitians who actually are able to focus on that patient with their specific diagnosis there for that specific study. When a patient comes here to Seattle Children's, they're being cared for by a team who knows the patient and knows their disease incredibly well and is going to do everything they can to focus on caring for that patient the best way possible.